The other thing to be really mindful of is to check with the caregivers whether there's been any subtle change in behaviour, because even the littlest thing, like they might be slightly more drowsy. The whole program is designed to support clinical and professional development around assessment. The support program includes our clinical nurse specialists spending some time once a week for 4 weeks in the facility, assessing complex residents that the facilities may be struggling with, demonstrating the assessment skills to the nurses that work in the facility, and then supporting and assessing them to see that they feel confident to carry on, so that we continue to develop the nurses' skills rather than take over. It's really important that we work with the sector, not come in and do to the sector, because it's a very specialist area of nursing, and even within health of older people it's its own specialty area. So the skill sets that the nurses have in residential care are very unique, and it's a matter of building on those, not devaluing them.
As a registered nurse in Takanini Lodge, the program of the Attract has been valued by our registered nurse because it boosts our confidence in assessing the patient, especially with the complex patients in the facility.
For us at Takanini, we've needed to develop a relationship with our DHB in the assessing of our residents, because it becomes important that we care for them holistically. We have advanced care plans and care planning around their needs. And so for us to ensure that the residents, get optimum high standard care or quality care, it becomes essential that we assess our patients in total. Part of that assessment process is we include the DHB in the form of the gerontology nurse specialist or team that support our services, because in past years we haven't had the support as we have now. And that's led to a very positive care for our residents. It's given us the ability to provide that high quality care. The hotline has been really good for us. We can address issues immediately without having to wait for referrals. And often the gerontology nurse specialists are available and will come on site almost immediately. Our main goal is to achieve clinical excellence, so that supports us in our goal. In the form of the training with the Attract training program, it's allowed our nurses to develop confidence in the way they discuss and assess their patients, because it's based on reflective practice, goal setting, and also the evaluation tools that they do get in order to assess the patients fully with the support of the DHB. Past years we haven't had that support, often having to deal with complex patients in difficult situations, whereas today we have the gerontology team that can help us initiate treatments and also support us in the assessment and the planning of care.